I think that the most important issue is that now we are starting to treat our patients according to a scheme that look at the precision medicine. And this is the most important, both in asthma and COPD. Mainly now we are focused on COPD, but even in asthma, we understand that we must treat the patients not in a general manner, but look at the specific characteristic of our patients. The final aim is to find the right drug for the right patient. We are a little far from this, but we are on the right way in looking at precision medicine. That's the most important issue. Unmet needs is to understand the real differences between asthma and COPD, to understand better the pathological condition, that physiopathological condition or pathophysiological condition that are under these two diseases, and to find new targets that can help us to treat our patients in the right manner. There are many things that must still be understood, even with the treatments that we have in our hands. I told you before that we are looking at precision medicine, but in this field we have questions to what we must give some answers. For example, can we avoid to treat all patients with inhaled corticosteroids? How important is to use alpha-1 antitrypsin treatment even in patients that have not a real deficiency of alpha-1 antitrypsin, and so on. We have a lot of questions to which we must still give an answer. Promising, I can say, for asthma, surely is the use of biological drugs. Now, at least for severe asthma, the introduction of anti-IL-5 drugs is extremely exciting, and I think that this could help us in improving our treatment of patients suffering from severe asthma, that are the part of the patients that need for more drugs and then for which we spend more money. And this is the very important issue. Another very good improvement is the introduction of triple therapy. Now the first trial seems to indicate that triple therapy, when I speak about triple therapy, I mean ICS, LABA, LAMA combination, fixed dose combination. This could be extremely important. We must understand for which patients, although we know that in Europe, at least in Europe, almost 70% of patients are almost already treated with the triple therapy. That's a problem. But now we will understand who is the patient that really needs for this treatment. There are important improvements in IPF treatment. It's not my specialty, but as a doctor, as a pneumologist, I treat also patients suffering from IPF. And also there are very interesting new treatments for lung cancer. And these are really new improvements that are helping us in treating our patients. Consider respiratory medicine more important than in the past. When I was a young doctor, we were just focusing on TB. Now TB is returning back, at least in Europe, and we must find new drugs for TB, to be honest, because there are a lot of resistances. But I think in general, respiratory diseases are under-treated, under-recognized, so there is a need to better work in this field. But what I always tell my fellows and my students, please, take your time to study. Read a lot and think a lot.